Hi, it's Dr. Jon Perlman. Many patients inquire what can they expect after they've undergone liposuction? What's it like right after the surgery? And what's it going to be like weeks to months later? So just in brief, I thought I'd give you a review. I make, and most doctors make, very small hidden incisions, no more than 1/4 of an inch in size, in areas that give us good access to the region to be treated. I close those incisions with tiny absorbable sutures that fall out by themselves and don't need to be removed. And the incision lines that are left, little marks, are pretty minimal in most people. Most people forget they even have them, in fact. Often for the stomach, one is in the belly button fold, quite well hidden, 2 in the pubic area. And if we're doing the grab handles, there's a small incision on each side in the flank area. Under the chin, there are 1 or 2 little incisions. For the arms, I make 1 tiny incision just above the elbow. So the incisions are really well hidden and not something to be concerned about for most people. Right after surgery, we put bandages on and a compressive garment. There's some discomfort, but it's usually fairly minor. We prescribe pain pills for patients who need it, but many patients get by well either with none or with extra strength Tylenol. You do need to take antibiotics for a few days. In my experience, it's advisable, but not for very long. Additionally, the discomfort over the first few days after surgery is relatively mild. Most patients have minimal bruising, some have none, but almost everybody has some degree of swelling. So my average patient, when the bandages come off at 24 hours after the procedure, notice an immediate improvement, with the rare exception of somebody who swells more than the average may not notice the improvement right away. But most people notice an improvement, and it gradually and progressively gets better every day. By 6 weeks, most people have a dramatic change in the area that's been treated. Initially, there may be some discharge of mostly water, blood-tinged water, the water that we pump in with the tumescent technique, into the bandages. So when the bandages come off, to see a little blood-tinged water is normal. By 6 weeks, the change is pretty dramatic, but there's still some swelling that persists for a total of 3 to 6 months. I encourage my patients to walk and get out of bed right after surgery and the next day. We don't want you sitting around too much, but equally, we don't want you exercising and exerting yourself. And I ask my patients to avoid salts and salty foods because that will enhance the swelling. Exercise you can start after 10 to 14 days in most cases and be back to normal exercise within a few weeks. You have to test it. Do a little exercise and wait till the next day, maybe do some walking. Then see if you feel more swollen and numb, cut back a little bit. But if you feel good and it actually improves your sense of how you feel and how the surgical area feels, then you can increase it progressively. I hope that answers your questions, and I look forward to possibly discussing liposuction with you in person. Have a good day. Thank you for listening.